I would like to welcome all of you to the first of many program events of the Downstate College of Nursing and to the Honor Society. I am Dr. Sandra Maldonado, the current president of the College of Nursing Honor Society, and on behalf of our dean and board members, I would like to welcome all of you tonight. First of all, I would like to introduce Dorothy Fife, Associate Vice President for Policy and Planning, who will bring us greetings on behalf of President Williams.
Dear distinguished alumni, guests, faculty, and friends, it is my honor to welcome the College of Nursing Honor Society home to Downstate on behalf of President Williams. President Williams regrettably cannot attend tonight as he's chairing the SUNY Council on Ebola. Our next strategic plan will be centered on health equity and the elimination of disparities through our academic, clinical, research, and public service programs. In spite of the collective progress in medical research, there are significant barriers to equal care that need our attention. To that end, President Williams recently initiated a lecture series with distinguished thought leaders and scholars to discuss the overarching issues and trends of importance to the academic community in general and academic health centers in particular. This is a great forum for the robust exchange of ideas and to encourage and inspire scientific curiosity and collaboration among our colleges, students, staff, and also lends itself to the area of health equity, and we should take advantage of that. This past summer, the President's Health Disparities Research Fund was launched by Dr. Williams to provide financial support to promising collaborative initiatives with the highest potential for major awards from federal, state, private, and industrial sponsors. To date, over 50 proposals have been received from campus faculty. The goal is to facilitate partnerships between our clinical, basic, and public health faculty with industry and the community to make us become a major innovator in and focal point for health disparities. We are committed to maximizing our diverse research strengths into bold, multidisciplinary research strategies and action, develop new insights into the complex nature of health disparities and innovative approaches to eliminating them. We are privileged to have the Honor Society present its first program on the shared vision of Downstate, leading the way to eliminating health disparities. We welcome Commissioner Graham, with whom we have a long-standing partnership with the shared goals of promoting health equity and eliminating health disparities. On behalf of Dr. Williams, thank you for coming to this program this evening.
Thank you, Ms. Fife. I would like to now introduce our Dean of the College of Nursing, my pleasure, Dr. Daisy Cruz Richmond.
Hello, good evening. On behalf of the College of Nursing faculty, staff, and students, I'm delighted to welcome you all to the College Honor Society's first program, you have heard, leading the way on eliminating health disparities. First of all, let me congratulate again the members of the inaugural group of our Honor Society. The faculty and I are enormously proud of your accomplishments. As you know, the Honor Society was established to recognize students and graduates who have demonstrated academic achievement and leadership potential to advance the nursing profession, and also to promote access to high-quality care for all people. You are the group that embodies that which the Honor Society was established, and you serve as role models and inspiration to our future students and graduates. Now, students, this is a recruitment pitch. So we will have our second induction next year. So apply. and I am confident that many of you will be eligible to be members of our Honor Society. I also would like to thank the Honor Society Board of Directors for organizing this program and selecting tonight's theme on health disparities. The College of Nursing, you have heard Dorothy said, has a commitment to addressing this issue as demonstrated in our rich tradition of educating nurses from underrepresented backgrounds, increasing the diversity of the nursing workforce nationwide. If you look at the national data, the diversity rate, nurses from underrepresented groups is only 12%. Since our inception in 1966, we have a range of 60 to 70% diversity. It's not only our commitment, we are living diversity. Equally diverse are our members of our faculty and staff. We take pride to continue in this tradition. In fact, many of our past and current funded programs are designed to expand student capacity while also increasing the nursing diversity workforce. I am pleased to also welcome our keynote speaker, Dr. Yvonne Graham. Commissioner Graham, whose professional career accomplishments include major roles centered on health equity and reducing health disparities. She's a nurse. Hooray! I am so proud that she is a nurse. She represents nurses not only on the state level, but also on the national scene. And I am privileged to have served with her at the Brooklyn Nursing Partnership. She served for many years as board of directors of Brooklyn Nursing Partnership, whose mission is also to recruit and graduate diverse students from the Brooklyn community, educating them in terms of cultural competency. I, for one, can tell you we are indeed fortunate to have her as our inaugural keynote speaker. I have heard her. She is a dynamic speaker, and I thank the committee for selecting her, and I thank her again immensely for accepting the invitation. Thank you, and again, enjoy the evening. Welcome.
Thank you again, everyone, for coming tonight. I'm really glad you came out. So I just wanted to acknowledge all the faculty members that came as well. You guys are awesome, so thank you for coming. And will the board members please rise? I'd like to acknowledge them as well. So we have Dr. Sandra Maldonado, who's our president. We have Sarah Marshall, she's our vice president. Konstantin Cheka is our secretary. Okay, we have Dr. Bailey. She is our treasurer. Dr. Miriam Cabral, she's one of our counselors. Dr. Janice, he's one of our directors. And we have Dr. Jermaine. Thank you so much. And Dr. Daisy Cruz Richmond, of course, as always, thank you for being with us. And we can't go without acknowledging the supportive staff as well. So Ms. Sullivan Jones, who really helps us behind the scenes to get a lot of this put together. So thank you all.
This is an auspicious occasion. It is the first program meeting of the College of Nursing newly formed Honor Society, and we are privileged to have our speaker tonight, Dr. Yvonne Graham, Associate Commissioner of Health for New York State and Director of the Office of Minority Health and Health Disparities Prevention. A registered nurse, Dr. Graham holds a bachelor's degree in health administration and community health from St. Joseph College and a master's degree in public health from Hunter College, CUNY. She has completed the executive program in business administration at Columbia University and was awarded an honorary Doctor of Law degree by her alma mater, St. Joseph College. Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in healthcare is the most shocking and humane." Dr. Yvonne Graham has made her life to eradicate such injustice. Her work celebrates the vision of our country and the cherished ideals of the nursing profession: knowledge, leadership, and a commitment to serve those most in need. Born and educated as a nurse in Jamaica, Dr. Graham continued her graduate studies in the United States, collaborating with Dr. Marsha Bain Smith, Associate Professor in Health Policy in the Urban Studies Department at Queens College of the City University of New York, and also with Dr. Marco Mason, a former college professor and immigration advocate, to launch the Caribbean Women's Health Association in Brooklyn. As a powerful advocate for accessible, affordable, high-quality, comprehensive health care for the most vulnerable populations, especially immigrants, for whom New York became their new home. Yvonne Graham grew the Caribbean Women's Health Association from a budget of $82,000 in its infancy to over $6.5 million in a matter of a few years. Under her leadership, the Caribbean Women's Health Association partnered with the Lutheran Medical Center to establish the first Lutheran Caribbean American Family Health Center, which former Secretary Thompson of the United States Department of Health and Social Services designated National Center of Excellence. Located at 3414 Church Avenue between 34th Street and East 35th Street in the East Flatbush section of Brooklyn, the center provides comprehensive primary health care services to adults and children through a professional staff fluent in English, Haitian Creole, Spanish, and French, says Magnifique. Dr. Graham demonstrated ability to implement systems for culturally appropriate care for vulnerable populations, led her to be chosen to serve as the Deputy Borough President of Brooklyn by former Brooklyn Borough President Marty Markowitz. Serving for 10 years in that role, Dr. Graham had primary responsibilities for healthcare policy and all human services. Her outstanding accomplishments in the roles were noted at the state level, and in 2011, Dr. Graham became Associate Commissioner of Health for New York State and the first Director of the Office of Minority Health and Health Disparities Prevention. In that role, she leads the New York State's effort to provide culturally competent health care to all its residents. SUNY Downstate Medical Center's mission includes the following: to care for and improve the lives of our globally diverse communities, to foster an environment that embraces cultural diversity. To that end, we are in debt to Dr. Yvonne Graham for agreeing to speak to us tonight. Her message will be a clarion call to action for every health profession in this auditorium. Please join me tonight in welcoming Dr. Graham, distinguished speaker.
Thank you so much, Dr. Maldonado, for your very kind introduction. To President Sandra Maldonado, to Dean Daisy Cruz Richmond, to the Board of Directors of the Honor Society, to Dr. Mary Germain, to the SUNY Downstate Nursing faculty and college community, members of the Honor Society, friends, and all of our special guests gathered here, good evening. It is my distinct pleasure to join the College of Nursing at your Fall Honor Society program to share some perspectives on health disparities or health inequalities and on your role as healthcare professionals in helping to close the gaps which currently exist. Let me first of all extend my deepest gratitude to the faculty here at SUNY Downstate College of Nursing for sharing your clinical expertise with those entering the profession or those seeking to advance their career, and for helping to shape the next generation of nurses. Thanks also to our practicing nurses for the strength, commitment, and compassion you extend to the patients in your care, never compromising on the quality of care you give, no matter how difficult the job or meager the resources. And I especially salute our aspiring nurses for choosing this noble profession. The SUNY Downstate College of Nursing Honor Society's tradition of recognizing and honoring students and graduates who have demonstrated academic achievement and leadership potential to advance the nursing profession and to promote access to high-quality care for all people is a worthy one. I'm especially inspired to learn that the majority of graduate and undergraduate students from this college come from Brooklyn, my hometown, and that you have chosen to remain in Brooklyn upon completion of your professional studies. In Brooklyn, as you well know, you will have the experience of working with our borough's racially, ethnically, and socioeconomically diverse populations, which brings incredible joys, but also great challenges and vast opportunities. From both your academic and practical experiences, I'm sure you're attuned to the fact that there are differences in health processes and outcomes between population groups, that racial, ethnic, and other underserved groups bear the disproportionate burden of poor health, and that these differences are most evident in an individual's socioeconomic circumstance, the physical and cultural community in which people live, how they understand and manage their personal health, and how effectively the healthcare delivery system serves them. Here in Flatbush, like many other diverse communities across the state, a perfect example of this picture is painted. Statistics from New York City Department of Health and Mental Hygiene show that regarding race and ethnicity, Flatbush has a higher proportion of Black residents with 77%, higher than Brooklyn and New York City overall, and more than half of Flatbush residents were born outside of the United States. Data on income show that 21% of the population in Flatbush live below the poverty level. And among the key health issues are obesity, which affects 1 in 4 adults. In addition, mothers in Flatbush are less likely to get timely prenatal care, and babies are more likely to be born with low birth weight than New York City overall. Further, Flatbush has elevated rates of sexually transmitted infections, such as chlamydia and gonorrhea. These numbers tell you what the disparities are. They tell you where they exist, and they tell you who are affected. The question they do not answer is why. What we do know about the why, from the literature and from our collective experiences, is that the circumstances surrounding these unequal outcomes are shaped by a myriad of factors, such as personal health behaviors, access to quality, affordable, and acceptable healthcare services, environmental and societal opportunities that are needed to achieve health and well-being, and the extent to which the people who are affected are engaged in identifying and prioritizing their health and social problems, and are able to participate in shaping and determining the solutions. They're also greatly influenced by the distribution of money, power, and resources at all levels of society, as these are the structural drivers of the conditions of daily life, and they transcend biological functioning. Because of the complex and cross-cutting nature of health disparities, thought leaders are citing the importance of strategies directed at the root of inequities rather than primarily treating their outcomes. And thus, they're calling for more collaborative approaches at all levels of society to address social problems in order to sustain change at the local community level. The bottom line for us as healthcare practitioners is, if we're to significantly close the gaps in health disparities, we must extend our practice beyond the biomedical paradigm and outside the boundaries of institutions. Central to this concept is building the skills necessary to engage and mobilize community residents to become active participants in identifying and setting their own health priorities and working with them to implement and evaluate programs aimed at improving their health and well-being. Further, because the foundation of health equity is rooted in social justice, an increasingly important role for healthcare providers is advocating for and supporting policy recommendations that will result in long-lasting social change. History has taught us that major advances in well-being and equality occurred as a result of advocacy and action at the local level. Examples of these are the 19th Amendment to the Constitution of the United States in 1920, which gave citizens the right to vote regardless of sex, the National Labor Relations and Social Security Acts of 1935, the Civil Rights Act of 1964, the Medicare and Medicaid Act of 1965, the Clean Air Act of 1970, the Federal Mine Safety and Health Act of 1977, and the Americans with Disabilities Act of 1990. These movements make it clear that eliminating health disparities and improving population health require many partners working together with communities around a common agenda. What you will find exciting about this work is the strength and tenacity of community residents when they're given the mantle of leadership and ownership, their capacity for collective transformational learning, and their ability to organize, mobilize, and sustain community well-being through collective impact. I want to switch gears now for a moment to shine the spotlight on your role in the healthcare delivery arena. You may recall the theme for National Nurses Week 2014, Transforming Healthcare Through Nursing Leadership. This theme is very poignant in light of the Affordable Care Act, constant advances in research and technology, and changes in policies and practice, all of which will alter the way healthcare is delivered. When President Obama took office, he appointed Dr. Mary Wakefield, a tenured nursing professor at the University of North Dakota, as administrator of the Health Resources and Administration, an agency of the U.S. Department of Health and Human Services. As Dr. Wakefield said in an RNL article she authored, today in the United States, the link between health policy and access to health care has never been clearer. Nurses find themselves at a historic juncture in the evolution of healthcare delivery when they can play a pivotal leadership role, end of quote. To this I will add that whether you are at the bedside, in the community, in the boardroom, or in the classroom, you will be required to become active contributors and innovators in creating a balance between providing the highest quality of patient care, advocating for health equity, and at the same time, keeping abreast of technology and research and their applications to clinical and community-based practice. In these roles, you will encounter many challenges which you must work to overcome, but there are also vast opportunities, and the decisions you make or the actions you take will have implications for healthcare policy, healthcare delivery, health outcomes, and the nursing profession for years to come. Some examples of these opportunities include keeping abreast of emerging research and innovative healthcare models and becoming proficient with new technologies, supporting the nursing profession by advancing policies that will close the gap in the shortage of nurses and nurse faculty, promoting diversification in the nursing workforce to better serve our increasingly diverse populations, improving the quality of care we provide, and advocating for improvement in the working condition for nurses. Let me speak for a moment on each of these. There are many emerging technologies, models of healthcare delivery, evidence-based and best practice protocols that will change the way nursing care is delivered. They include genetics and genome mapping, robotics and biometrics, new tools for diagnosis and treatment, new infection control procedures and administrative protocols, as we have seen in the case of Ebola, the use of electronic medical records, three-dimensional printing, social media, e-health messaging, and so on. As nurses, You will need to keep abreast of these developments and acquire the skills to use these technologies to facilitate preventive, community-based, and clinical practice. However, as the role of nurses evolve, we must be careful that as we maximize the benefits of technology, we do not lose our most defining characteristic, that of caring. The human connection is the art of nursing. It is the nurse who is there before and after the doctor stops to diagnose and treat. It is the nurse who checks the vitals, manages the pain, comforts the patient, greets the families, and listens to his or her concerns. We must never, ever devalue that human connection. Secondly, as you know, for decades we've been challenged by a severe shortage of nurses and nurse faculty, a shortage that truly threatens not only patient care, but also the day-to-day quality of a nurse's working life. According to an article in the October issue of Nurse.com, the American Nurses Association is advocating for more funding to increase the nursing workforce, citing that the U.S. will need to produce 1.1 million new RNs by 2022 to fill newly created jobs and replace retirees. But experts predict that even at this growth rate, by 2025, there will still be a shortage of about 260,000 RNs. Here in New York State, data from the Center for Workforce Studies at the State University at Albany reported that the vast majority of actively practicing RNs in New York State, nearly 2/3 of them, are age 50 and older. The ANA is advocating for a multi-pronged approach to help inform effective program and policy development to assure a balance between the supply of RNs and the demand for their services. Recommendations include increasing federal funding to bolster nursing education by developing and recruiting more nursing professors, ensuring an adequate number of clinical training sites for nursing students, and increasing incentives to attract the next generation of RNs. As nurse leaders, you cannot afford to stay on the sidelines and just read these articles. You must become involved in activities aimed at advancing an agenda that will strengthen and sustain the nursing profession. Equally important are workforce diversity issues. Approximately 33% of the U.S. population is part of a racial or ethnic group, yet only 18% of our nursing students are. By 2050, African Americans, Asians, Hispanics, and American Indians and Alaska Natives will comprise the majority of our population. However, the Center for Workforce Studies also found that active RNs in New York State are not as diverse as the rest of the state's population. In fact, in 2013, while 18% of the state's population was Hispanic, less than 5% of the state's nursing workforce was. In that same period, African Americans comprised nearly 15% of the state's population, but less than 12% of the RN workforce. The U.S. Department of Health and Human Services, in its case for enhanced national standards for culturally and linguistically appropriate services in healthcare, otherwise known as CLAS, indicated that culturally and linguistically appropriate services are increasingly recognized as an effective mechanism for improving the quality of care and helping to eliminate health disparities, and recommends that the healthcare workforce be equipped with the knowledge, tools, and skills to appropriately manage cross-cultural encounters with the individuals in their care. You can play a role as mentors in your spheres of influence to attract racially and ethnically diverse students to the profession and ensure that relevant information about nursing as a career is provided in schools and at the community level. But while an adequate and diverse supply of nurses will provide the manpower necessary to carry out the task of patient care, an equally important component is the quality of nursing care. As we all know, the nation's healthcare delivery system are being held to higher standards of quality improvement, and nurses are integral to quality improvement as they spend the most time with the patient and are in the best position to positively influence the patient's experience. Consequently, your insights and engagement in quality improvement activities are essential to optimal health care. Another issue of ongoing concern for nurses is improving the working conditions. Our work environment plays a large role in our ability to provide quality care, and the atmosphere of a facility impacts everything from the safety of patients and their caregivers to job satisfaction. Studies consistently show how work environment issues such as staffing are linked with patient outcomes, length of stay, and chance of death. The American Nurses Association supports a healthy work environment for all nurses and patients and maintains that nurses have the right to practice in environments that allow them to act in accordance with professional standards and legally authorized scopes of practice. But the linchpin of your success in advocacy and programmatic efforts will depend on your ability to nurture your inherent leadership potential, to cultivate new skills, and to drive the transformation you wish to see. One of nursing's most effective leaders and political activists was Florence Nightingale, who used advocacy and collective power to change policy and advance reform in prisons, hospitals, and the army. An accomplished author on sanitation and health, she started to develop theories of sanitation that eventually reformed healthcare. She applied statistics to bring about social change, presenting data to politicians and government officials. And as a mentor, she taught students proper observation and assessment skills. Above all, Florence Nightingale maintained her commitment to humanity. A remarkable leader, she truly was the change she wanted to see. So by now, you may be asking yourself, am I a leader? How do I build leadership skills? And how can I use these skills to contribute to my personal growth and my professional competence and the nursing profession? The internet and bookshelves are filled with articles and books on leadership, often debating on the various theories and practice of leadership and offering opinions on whether a leader is born or whether leadership skills can be developed. I have come to believe that at various times in our lives, all of the theories about leadership and even combinations of theories are true. We may be born leaders, we can acquire skills and learn how to lead, and there are times when leadership is thrust upon us and we can rise to the challenge and lead others with our vision. But all of us have traits that can help us to become effective leaders. And as effective leaders, we can be a catalyst for the change we want to see both in our daily lives and in our professional settings. So when there is work to be done, we should think of the words of Mother Teresa. Do not wait for leaders. We can all be leaders. To this I will add, you cannot afford to wait to make your contribution, nor can our communities afford to wait for it. You must begin tomorrow in practical and tangible ways, because it will not be enough to talk about leadership and service. Your work must be quantifiable. However, I do have one reminder as you begin your leadership journey, and that is, before you lead others, you should know yourselves well. This requires thoughtful and reflective self-assessment. So I encourage you to take time to identify your strengths and weaknesses, develop a self-improvement plan, and build on your strengths. That plan should include strong interpersonal communication skills, such as the practice of dialogue, listening in order to understand and to be understood. This is critical for interacting with your colleagues, your patients, and their families, and the wider community. Be open-minded. This will help you to understand and respect diversity, engender a sense of trust and belief in the power of collective action, and build and nurture partnerships. Above all, be passionate about the issues you believe in. You will come to see that leadership is common sense, hard work, and discipline coupled with self-sacrifice. That it is good judgment topped with honesty and ethics, and the ability to inspire others to follow your path. Real leadership starts with setting a shining example in your workplace and doing what is right when you're faced with issues of social responsibility and ethical judgment. Finally, I want to remind you that as caregivers, while you must serve and serve well, you must be careful not to serve others at the expense of serving yourselves. Find ways to recharge in order to avoid burnout. Follow the advice you give to patients and take care of your physical health. Develop and maintain strong, healthy relationships. Enjoy your families and nurture your faith relationship. These will be your anchor when times are difficult. And hold steadfast to the ethics and standards of the nursing profession that makes us unique. Remember that for many patients, it is their experience with the nurse, that care, that compassion, and that comfort during life's most vulnerable moments that stays with them long after they go home. I would like to again express my gratitude for this invitation. It is great coming home to SUNY. I've stood at this podium many times. I've thoroughly enjoyed spending this time with you, and I wish you much success on your journey. Thank you so much.
Thank you again, Dr. Graham. That was amazing. So thank you all again for coming. I'm Angela Quinn. I'm going to be taking over as the next Society chapter president, which is exciting. I forgot to acknowledge Dr. Gerard. I'm so sorry about that. She's also one of our board of directors. In my nervousness, I totally went by her name, so I apologize. So again, thank you for coming, Dr. Graham. That was incredible.
Let me acknowledge the presence of Michael Harrell, who is our Assistant Vice President for Governmental Affairs.
So before I give some closing remarks, I just wanted to ask you to be mindful of the evaluation form that's in your program. If you could fill that out, we'd greatly appreciate it. A lot of effort goes into putting these events together, and if there's any input that you have to make it better, we'd really like to hear it. So thank you. So as the only academic medical institution in Brooklyn, Downstate services a unique and diverse community comprised of people from every country of the world. Look around the room. It's incredible. While we're a small college, we really do big things. I love being a part of this family, and I'm glad that you're all here as well. Dr. Graham couldn't better represent all that we are and all that we stand for. Her passion and drive is evident in all that she does. We're so honored to have her here with us tonight, and I'm confident that each and every one of you gained something awesome from her words. Dr. Graham is just that. She's everything that we stand for: excellence, scholarship, and service. We couldn't think of anyone better to inspire us and captivate us with her words. So please accept these flowers that we got for you. It's a special gift we gave twice. We had to take a picture first. So And as a further extension of our gratitude, the College of Nursing Honor Society is making a $300 donation to the Caribbean Women's Health Association. So thank you again. Maya Angelou once said, "They may forget your name, they may forget your face, but they'll never forget how you made them feel." And I know that you're not going to forget Dr. Graham as well. So thank you again for coming, and please join us for some refreshments outside. Thank you again.